name is Marcia, and I'm a licensed insurance agent.
So Marcia, what was your problem?
I was having trouble with my dexterity and my balance, and I just had a slight ache in my neck. Nothing that would really alarm me, but it was the hands that made me go.
Marcia, hi.
Hello.
Dr. Canner, how are you?
Hi, Dr. Canner. Nice to meet you.
What's the problem you're having?
Did you really think it was that bad?
Honestly, I did. I knew something was with my hands, and I thought, all right, so I've got double carpal tunnel. Big deal. And then when I found out differently, it was a whole different story. I am having the strangest things. It's almost like it's double carpal tunnel, but I don't know that that's possible. My hands are numb and tingly. I have no dexterity at all. I mean, just the finest little thing, barely get my makeup on. The weirdest thing to me is this part of my legs I cannot feel. I mean, if I do this, I can't feel it.
Marcia didn't have a lot of pain. She had more of a fatigue, more of a spasticity, couldn't manipulate things, couldn't walk without feeling like she was going to fall. When she changed direction, she lost her balance. And it wasn't something that she was experiencing a lot of discomfort from. This is not uncommon with folks that have cervical stenosis. A lot of times individuals will not have any discomfort at all. They'll just notice that when they're walking they may lose their balance. When they change directions they may stumble a little bit. When they try to open a jar it may be difficult. And these are the early signs of stenosis, and as that progresses it may develop into frank weakness and frank inability to use your hands or inability to walk. Marcia, what we're looking at here is this is a model of your neck. And on the MRI scan, this is your brain and this is your spinal cord. The spinal cord is an extension of the brain. It's made out of the same basic stuff. And normally the cord is in a spinal canal and there's plenty of room around it. So normally the spinal cord lives in a channel, and when you move around it. And it's designed that way because when the spinal cord gets touched, it potentially can get damaged. And what's happening with you is you're developing arthritis, and the arthritis is causing bone to grow into the spinal canal. And as a result of the bone growing in, the spinal cord itself is getting pinched. So what's happening is the sensors in your feet are trying to communicate with the brain and tell the brain where the feet are, and the brain's trying to tell the feet where to go, and what's happening is the signals aren't getting there fast enough. So when you move your foot, your brain doesn't know where your feet are, and as a result, you really have difficulty coordinating your movements. Same thing's happening with your hands. The goal here is, number one, to get the pressure off the spinal cord. In other words, we have to take the channel that's here, which is normal, and make that area where the cord is severely compressed look like that area. And the options are twofold. Number one, we can go in from the front of your neck and we can remove these large spurs and fuse the bones together. The alternative to a fusion is we can go from the back of your neck and take the arch, which is pushing on the spinal cord, and move that back. And the arch over the back of the cord essentially is too small. So what we can do is cut the arch and hinge it like a drawbridge. And if we hinge it, we make enough room for the spinal cord, but we don't have to fuse it. And the advantage of that is we can maintain your mobility, we can fix the problem and maintain the functionality and maintain the motion of your neck. Push hard, good. Pull hard, pull back against me hard, good. Pull against me hard, good. Pinch your fingers like that. Pinch them really, really, cool. Make a little circle, don't let me break it.
How do you feel now? I mean, how much of a difference has this made in your life?
I cannot even tell you how much better I feel. I really can't. I've got energy again. I have none of this. When I woke up after surgery, it was like almost instant. I just hit thumbs a little bit. That's gone. I just have energy like I haven't had in years.
Marcia is back to a very active, very happy lifestyle. She's feeling more energy than she had for a number of years. She's no longer experiencing a numbness. She's no longer experiencing a difficulty with using her hands. She's no longer having any difficulties with her balance. And she's got a lot more energy. She's able to get up and do a whole day without feeling like she has to lie down. And essentially what's happened is the spinal cord is now able to communicate with the rest of the body effectively, and the muscles that weren't getting signals before are now getting signals. Fortunately, she had this fixed early enough where she didn't have a lot of permanent damage. The majority of what she had was completely reversible, and her mobility is not compromised, and she has no additional risk of having future surgery as a result of the operation.